host, so it kind of being funky. There we go. Awesome. Thank you, Kelly. All right. Again, welcome. My name is Becky Huckabee. Here we go. We'll do another introduction since now we are recording. I am one of the two JBBS program managers for the BHA, and I will pass it on to Kelly.
Good morning, everybody. My name is Kelly Russell, and I am the other JBBS program manager here at the BHA. I will pass it off to Alex. Actually, let's go to Danielle first. Danielle, if you're able to introduce yourself.
Hey everyone, my name is Danielle Culp and I'm the Director of Criminal Justice Services. It's so good to see you all. Great group. Alex.
Hi everybody, so my name is Alex Clayton. I'm the data coordinator for criminal justice programs, and I'm working specifically with JBBS right now on monitoring and evaluation for JBBS.
And I'm Karen Chaplow. I'm the Fentanyl Education Program Manager for the BHA.
Thank you. Thank you. Do we have anybody else from the BHA? All right, great. Well, we will go ahead and get started into a few announcements. I am also trying to multitask, sending a couple people some Zoom links, so just bear with me if you could. So we have a few announcements for fiscal year 25. So this is our first meeting of fiscal year 25. Fiscal year 24 is wrapping up nicely with our invoices. We've received a little less than half of our invoices. Please remember that those invoices are due here in a couple of days. However, I am also going on vacation. I'm going on vacation starting next week, actually tomorrow, and I will be gone for 2 weeks, and I am the one that processes those invoices. So if you get them in by today and they get sent to me by our BHA payment folks, I will go ahead and process them today. If not, there will be a slight delay on the processing of invoices. Nothing like crazy, like 45 days or anything like that. I will more than likely process them as soon as I'm back on August 5th. If you need anything from me, as far as a program manager, I will be gone, but Kelly will be here, Alex will be here, Danielle will be here. So if you need anything, please reach out. If you're wondering about any end of the year billing, please reach out to me today, since I will not be checking email starting tomorrow. As far as monthly contract monitoring tool for fiscal year 24, that is also due by July 20th, so here in a couple of days. If we could please get that in as quickly as possible. We have Alex here who is going to be helping put together our annual report. As a reminder, I've reached out to a couple of you, and Kelly sent an email to everybody. We no longer have the annual report template. We combined a lot of the annual report questions into our monthly contract monitoring tool. So that is something extra that you all do not have to do this year. We will take the data from our monthly contract monitoring tool, and Alex will be able to get an annual report from that data. So super awesome that we don't have to have an extra step for you all at the end of this fiscal year. Fiscal year 25 invoice templates have been sent out. Please use that only for your July invoice. The June invoice should still be on the fiscal year 24 invoice template. July will be on fiscal year 25. If there are any questions about that, if you need the invoice template, if the invoice template is wrong and has the wrong contact information on that second tab, please reach out to me and we can get that fixed. I think that's all I have for announcements. Kelly or Alex, any announcements from you all?
Nope.
Just for those of you that we're still waiting on those chestnut agreement forms, we need those in as quickly as possible. Those are very overdue at this point, and so we need those turned in. I know some are in legal process. We're not waiting on too many more, but we do need those done as soon as possible. If you could make sure that's happening in your facilities. Thank you.
Kelly. And as far as your invoice templates, I want to go back to our fiscal year 24 invoice templates. We really would like those submitted as soon as possible. I know sometimes there's a delay at the end of the fiscal year, but they are due coming up in a couple of days, and we really, really, really need those in as soon as possible. We've got to get those processed and in, so please get those in so I can get them processed on my end, and we can get spending done. So far, spending is looking very nice. Everything's looking really good. But like I said, if there are any questions, please reach out to me today. As far as the invoice, it looks like in the chat from Sarah, the invoice from Chestnut, That's really up to Chestnut to give you that invoice for the user, not agreements, but user platform. That's going to be up to Chestnut. If you have questions about receiving that invoice, please reach out to Scott and he can let you know when you might be receiving that. If you would like Scott's contact, or if you would like us to reach out to Scott for you, please reach out and we can help facilitate that. Once you receive the invoice from Chestnut, you can go ahead and bill that to JBBS. So that's going to be, thank you, Kelly. So that's going to be just on your July or August invoice whenever you need to pop that on there. No big deal. Awesome. Sarah got that. We're good to go with that. Other than that, I think we're good with announcements. So if there are any questions, concerns, please put it in the chat. And we've been rocking because we do have a full schedule today. And I know Amy has somewhere else she needs to be no later than 11 o'clock, but probably earlier than that. So I'm going to stop talking and I will go ahead and pass it over to Amy Miller with today.
Good morning, everybody. I'm real excited to be here with you all and have this opportunity to talk about one of the federal grant programs that I manage. I am a grant program manager for the Colorado Division of Criminal Justice and the Colorado Department of Public Safety. And I manage several of the federal grants from the Bureau of Justice Assistance, Department of Justice, through the division. One of those is the Residential Substance Abuse Treatment Grant Program, and that's what I want to present to you all today as an opportunity that's upcoming for your consideration, and that I hope some of you will take advantage of. So we call that program RSAT for short. Basically, the RSAT grant program assists states like Colorado with developing and implementing residential and pretrial substance use disorder treatment programs within local correctional and detention facilities, as well as state correctional facilities for programs and services for incarcerated adults and juveniles. RSAT program funds can be used to implement 3 types of programs, basically, which are residential, jail-based, or aftercare services. Agencies that are eligible for these funds are state, local, or tribal government agencies for projects in prisons or youth detention centers, jails, community corrections, or aftercare service providers. Eligible activities include residential substance use disorder treatment, or it can be residential substance use disorder and co-occurring mental health disorder treatment. Actually, the emphasis is on the SUD treatment, but if there's a co-occurring mental health issue, then treatment can be provided for both of those two needs together, actually. In a jail setting, if your agency wanted to do a residential SUD treatment program under the RSAT grant, there's some program criteria that you have to follow, and those are to engage individuals in your facility that have SUD or co-occurring substance use and mental health disorders for at least 3 months. You would need to do periodic and random drug testing of those individuals while they're in your program, and then upon release while they're still under community supervision. You would need to make every effort that you could to establish a therapeutic community. So that's a evidence-based practice where essentially you're making every effort you can to keep the people in that program separate. from the rest of the general population, or set apart from the general population. And if you can't do that in a physical separation, then we can request a waiver through the Bureau of Justice Assistance, so that you can really more or less programmatically keep them separate in a therapeutic community. And then the last criteria for residential treatment in a jail is providing aftercare services. New to the fiscal year 2023 RSAT funding, which is the award that the state is looking to give out to communities right now, is eligibility to provide jail-based pretrial SUD treatment programs. So all those criteria that I just went through for those residential programs, you don't have with the pretrial population. And what you would do in that kind of a program, basically, in terms of what's eligible under RSAT, is initiate or continue an evidence-based SUD treatment program, which can include medication-assisted treatment under RSAT, with that pretrial population while they're in confinement, or you can foster connections to that treatment in the community upon pretrial release. And so there's a lot more flexibility with that allowable type of program under RSAT. And we were very happy to see that as a new allowable under activity under the grant program, starting with the 2023 funds. And let's see, what else? Typically, in terms of the application process for RSAT funds, we usually have been putting out an announcement of available funds either in late spring or early summer. Due to a variety of reasons, we are not on that schedule this year. Part of that is because due to COVID and a whole lot of other issues, we have not been able to distribute the 2021 RSAT federal award that we received, or the 2022 award that we received. And so that's pushed our schedule this year out a bit. And we are in the process of working with the Colorado Department of Corrections on a project expansion where we'll be getting those funds out the door. And so that puts us in a great position to actually be able to use all of our 2023 RSAT funds to support jails in the state. And we also really intentionally wanted to do that because of the ability for jails now to use these RSAT funds with pretrial populations and not have to meet all those other criteria that have been required of jails in the past. So we, on average, have about $575,000 a year to award out in RSAT funding. That average applies to the last couple of years of awards because the amount of funds allocated to the state have continued to increase year over year for the past 4 or 5 years now, which is, I think, a positive thing, especially given the opioid crisis and the real need for these funds. This year, we are looking with the 2023 funds to give out a little over $583,000 to jails. And we'll probably be, I was really hoping to get the funds open for applications this month. But I too will be going on vacation starting next week, and it's just not been possible to make that happen. Between that and part of our team in the division that's been working on the development of a brand new online grant management system that will be launching later this year. So at this point, we will definitely be opening the 23 RSAT funds up for applications in August of this year. If at all possible, we would start those projects October 1st of this year, but we can start them later than that. That timeline is our own internal timeline. But the goal really is to get those projects started before the end of 2024. Those grant awards can be issued for a year. They can be issued for 18 months, 24 months. We really want to work with you all to try to figure out what your needs are and what's going to work best for you. The way that we accept applications through DCJ is in our current online grant management system, which is Zoom Grants. RSAT funding does require a cash or an in-kind match. And so typically what the Bureau of Justice Assistance requires is a 25% match of other funds that you have that you're using for the same purpose, or in kind, so services, volunteer hours, etc. Your JBBS funds can be used as matching funds for RSAT funds. There is a significant overlap between what is allowable under JBBS and what's supported under JBBS and RSAT. It's nearly identical. So you can absolutely use those funds to match your RSAT funds. We do end up actually requiring people to match at approximately 27% of their award, because DCJ does not have the ability to provide the match on the federal award. And so we have to have our grant recipients provide that match on our behalf. But we know how to calculate that, and we can help folks figure that out and figure out how to handle that in your accounting system. We provide lots of technical assistance, so that's not a problem. We can help you figure out how to handle that match process if that's not something that you're familiar with. So these funds, like I said, can be used for so many of the same things that you are already using JBBS funds for, as long as the funds are being used to support aspects of, SUD and or mental health disorder treatment programs. So that can be personnel costs. It can be, if you contract any of those services out, it can cover contract costs. With medication assisted treatment, it can pay for FDA approved medications used for MAT. RSAT funds can be used to pay for costs associated with drug testing. You can even use RSAT funds to cover costs involved in administering the RSAT grant. So that's allowable as well. You can request indirect costs as part of your grant to help offset some of your costs that you can't directly attribute to your program. That typically those are more administrative costs in nature. You can use funds for folks when they're released back into the community, for transitional housing expenses, for utilities, for continuation of substance use disorder treatment in the community, for continuation of MAT in the community. There's almost nothing that really you can't use RSAT funds for. That said, you cannot accept an RSAT award and use it to offset the part of your budget that's already being covered by your local government budget. That is supplanting, and that's not allowable under any federal grant. Also, just the typical things that you can't use federal funds for otherwise, like lobbying. You can't use the grant for lobbying. But you know, as long as you can show that there is some kind of a nexus with your use of RSAT funds, you know, we have funded, for example, guitars for the Department of Corrections to use in their therapeutic community program with participants, so that, you know, they've got music as a part of their weekly group meetings to help facilitate the treatment process and a sense of community and connection and recovery. So it's pretty broad what you can use these funds for. And I think that's like the bulk of the information that I wanted to share with you all. So I would love to open it up to questions that you might have.
You can also put a question in the chat if you would prefer not to speak on the camera. I'm watching the chat as well. But yeah, any questions for Amy? This is a great opportunity, especially with our funding situation this year.
I have a question. It sounds like we would qualify with pretty much what we're already doing. And we're out in Elbert County, so we're pretty rural, and a lot of the rehabs are so far away, excuse me, that, you know, we get these people set up, or when I say we, I say my wonderful mental health person gets them set up in rehab, and then there's just no transportation. And that's what we really struggle with. So they may have to get themselves there, and then that's a big, huge roadblock in maybe they just never show up. And so we've just really struggled with trying to get a transportation solution. So it sounds like maybe this grant could possibly help with that.
That's right, Jennifer. You can request funds for transportation. And
that would be
that purpose. Yeah.
That would be huge for us. I mean, like massive for us, and possibly other jails that are in our situation too.
Yeah, absolutely. I mean, you could even request to lease a vehicle with these funds.
Wow.
But you could also pay a vendor for transportation services as well.
Another big obstacle that we've had is we're so small, we don't pay for like a 30-day supply of MAT meds. And for some reason, if they don't have Medicaid, which right now they don't typically have Medicaid, it takes them a while to get Medicaid set up. So they don't have the cash to pay for a 30-day supply. So there's always that gap. And that's a huge roadblock to their sobriety. And so it sounds like we might be able to use funds to get them a 30-day supply of Suboxone also.
Correct. Mm-hmm.
Both of those would be gigantic for a small jail like us.
Great. Yeah. And I hope we can help you with that.
Yep. Thank you. Appreciate it.
Amy, we had another question in the chat. Can it fund LAIs for the co-occurring population?
I don't know what that is.
Oh, I'm so sorry. So
It's okay.
LAIs are long-acting injectables.
Oh, right. Okay. Yes, actually, it can.
Awesome.
As long as they're
Graham?
FDA approved, that's really the only requirement.
Wonderful. Any
Is
other
there any-
questions for Amy?
Yeah, real quick. Is there any perhaps I just missed this. Is there any like written material to go over some of this that I would like to take a look and then strategically think with our partners in Larimer County to see what we might could make work out amongst those partners.
Sure. Yeah. The FAQ that frequently asked questions that the Bureau of Justice Assistance compiles about the program was sent out as part of the materials for the meeting. And then my email address is in the meeting invite as well. And so I'd welcome you to reach out to me and we can have a conversation. You can ask questions. I'm available at any time to do that. And happy to do that.
Amy, there's a question in the chat. Is the required federal reporting quarterly or monthly?
It's quarterly. So I'm sorry, I forgot to mention that. So in terms of reporting requirements, RSAT's one of those federal grants that has a set of performance measures that comes along with it. And a lot of those performance measures from what Becky and Kelly and Alex and I have talked about are nearly identical to what you're already reporting on for JBBS. And they being BJA, they have a system called the Performance Management Tool System that's online. And so you would be doing a quarterly report of those, the data you've collected for those performance measures in that system. And that system is something that if you're not familiar with it, I can help you get familiar with it. You can also take a look at what those performance measures are ahead of time, if that's helpful, and helping you make your decision about whether you want to apply for funds or not. And then DCJ requires quarterly reporting as well. But I would absolutely encourage people to set up their goals and objectives for their RSAT project to align with their with the performance measures that BJA requires and with what you're already doing for JBBS, so that you are basically streamlining your reporting requirements across different funding sources. And you can pretty easily copy and paste what you reported to one entity into the other reporting system. So we do require quarterly narrative or progress reports. How's it going with your project? What were the activities that you completed in the past month or the past quarter? Sorry. Are there any barriers or roadblocks that you've run into? Is there any help that you need from us in overcoming those? Are there any resources that you could use? That kind of thing. And then a financial report quarterly too. So what were your expenses during the quarter? And then along with that, there's like a online invoice that you complete and submit in the same Zoom grants online grant system that DCJ uses. And that's how we get you paid back. Basically, it's a reimbursable grant program. So those are the reporting requirements. The deadline typically for the PMT report for BJA is going to be the 15th of the month following the end of a quarter. That's typically our deadline as well. but I'm very flexible. If you let me know that you need more time, I'm going to give you more time, and it's not going to be something that's used against you. I just don't, I think this is a partnership. That's the way I work with the grantees that I have now. And it's not about being punitive. We want to see people make the most of these resources that we have to offer and really, you know, benefit the population that they're working with. And in order to do that, I think it needs to be a partnership. Any other questions? Were there any others in the chat?
Was one, but it sounds like he answered that question. So I think we're good there.
Right.
So, any other questions for Amy? And I want to be clear that these are DCJ funds. We've had a couple of conversations with Amy and just some county jails regarding these funds that we know are low on funds right now. Please, everybody, keep in mind we have had some conversations, but we can make the larger announcement now. We will be having SOR funds added to the JBBS budget throughout the fiscal year. So JBBS will be receiving $750,000 in SOR funds. We're talking with our larger jails about those funds as they have had SOR in the past. But the goal for these funds is to give them to larger jails and then hopefully reallocate some of those larger jails JBBS funds to smaller jails to be able to cover some of the budget shortfalls that we have this year. However, we understand that that $750,000 is not going to make all jails whole, right? Larger jails or smaller jails. So RSAT is also here in conjunction with JBBS to hopefully make jails whole. Yes, this is a different grant. Yes, this is a different application process, but we are working close with Amy to try to make it as simple as we can for all of you to try to use some of your JBBS reporting, actually, hopefully all of your JBBS reporting for what Amy needs. And as she said, copying and pasting to make these funds easy. Do we need to spend JBBS dollars? Absolutely, yes, we do. And we want to prioritize that. Sorry, Amy, we're going to be selfish on that way. But we also want these funds to be easily accessible, these RSAT funds, and we want folks to be able to spend these funds and use them for what you need for their program. Speaking of LAIs, I know a lot of programs want to expand to LAIs, MAT injectables, because there are a lot of diversion issues going on in facilities. Pre-sentence programming, all of this stuff that we could be able to do. If it doesn't fit within RSAT, it fits within JBBS, and then RSAT can cover the gap that you're using those JBBS funds. So please think about RSAT, think about what would be useful. Let's have a conversation. If you would like a follow-up meeting with Amy or us, please let us know. We have met with jails and Amy, so we're all on a kind of united front here, letting you know that we are here to help you and make sure that you have the funds that you need. So please be communicating with us. We are meeting with our larger jails about the SOR funds on August 5th. If you can give us an idea of what you are needing to make your budget whole by August 5th, that would be really, really great. I know I just said I'm going to be out of the office in the introductions, but shoot me an email, send me an email, reach out to Kelly. Let us know what you are needing, and we can make sure, or at least our goal is to try to have RSAT, SOR, and our amendments for JBBS to add funds to jails all kind of hitting at the same time around October 1st. That is the goal, and we need to get rocking on that if that's what we're going to do. Kind of took over there, and I apologize, but wanted to add some stuff.
No, that's great, Becky.
Oh.
And you know, like Becky said, we, you know, our conversations have really been centered around where are the gaps, where are the needs, how can we help try to ensure that your programs are whole moving forward, your budgets are whole moving forward as much as possible. The one thing I would add in terms of sustainability of these funds that I forgot to mention is that these are formula grants that the state gets every year. This isn't a competitive grant program. So as long as we submit the application and it's, a halfway decent application, although I strive for better than that. But we're going to get the funding and it's going to be available. So, and it's been around for a long time. So, and as I said earlier, it continues to steadily increase. At least it has for the past several years. So I think it could be something that can help supplement your budgets and your programming, and do so for years to come. So consider it. I hope you'll apply. I provide people with technical assistance all the time around helping you figure out like what to apply for. I can't write your application for you, but I can certainly help you think through how to put together your application. Once we do open this up for applications, it'll be open for as long as people need, really. We're not going to open it just for 4 weeks or 6 weeks. We're going to give people time to apply. We don't run this as a competitive process. This isn't a competitive grant program. And BJA doesn't, that's not a requirement from them either. So we don't have to run it that way. But please feel free to reach out to me, and I really appreciate your time and attention today and the opportunity to present on this grant program to you all, and really thank the JBBS staff for allowing me to have this platform to be in front of you all to talk about this, and please be in touch.
Awesome. Thank you so much, Amy. Appreciate your time this
Amy.
morning. I know you've got other places to be, so we'll be in touch. As always, we'll be in touch.
Thanks. Have a great vacation.
Thank you. You too.
Bye.
Bye-bye. All right, everybody. Thank you so much for that. We will, if there are any questions, if you're thinking about it and there are any questions, as Amy said, please feel free to reach out to one of us or reach out to her. I believe she did post her email address in the chat. If she did not, actually, I don't see it. Let me get that in the chat real quick. While I'm talking, it's hard to multitask. Here we go. That is in the chat now, so please feel free to reach out to her directly. If you need a copy of the RSAT fax form, it was sent out, but if you would like a copy, please email me directly. I don't want to inundate Amy with emails, and I'm fine being inundated with emails. Please email me, but please do so today so I can send that to you prior to my vacation. On that note, we are right on time. We're going to pass things off to Alex.
Great. Thanks, Becky. Appreciate it. So yeah, hello everybody. Good to see you. It's the first time I've seen all the jails at one time. I've met with a lot of you individually and with Becky and Kelly for the last couple of months. So it's great to be here in front of everybody. So today I wanted to do a couple of things. I want to start off just going through a couple of talking points about the monthly contract monitoring tool. And then I want to go over the training document that we sent out with the materials for this meeting. And then I want to go through what the new monthly contract monitoring tool looks like on the Google Sheet. So you just have, or the Google form. So you have some context of what it looks like before you get started on it. So the first thing that I wanted to talk about was the fiscal year, last fiscal year, the monthly contract monitoring tool that's due in 2 days. I wanted to put it out there that because this is the last month of that fiscal year, if you need a little bit more time for that, I think that's okay. Because we want it to be as accurate as possible. We have to take all of those numbers from the last 12 months for every jail and put that all together into an annual report. And so, 2 days is not a lot of time if you want to go back and double check. So, if you need a little bit more time to kind of get that finalized, I'd rather have it be accurate so that we can use it and make a good report with it, right? And demonstrate to the higher ups like, hey, this program is working. Here's how it's operating. That's what's most important to me. But for future reference, right, for the new monthly contract monitoring tool, that got sent out with this meeting. That one's not due until August 20th. So that's about a month from now. So there's still some time to kind of get the last one finished up and accurate. And then, you have 20 days after the end of July to kind of get the information in for the new one. And that'll be kind of how the schedule works going forward. We'll send the new monthly contract monitoring tool out for each month. There'll be one for each month, and it'll get sent to you directly. And we'll send it out about the first of the month, and you'll have until the 20th, right? So we'll send the August one out on September 1st, and you'll have until September 20th to fill that out. So I just, we wanted to make sure that you had enough time to kind of put the information in there, collect everything together, and if you get it done on the second day of the month or the third, great, right? And if it takes you until the 20th, that's fine. But moving forward, we're hoping that 20 days is enough time to get it all in there. And then the goal here is really to take each month and be able to put data together and analyze it. And so with the annual report, I want to get in front of everybody in October at the next quarterly meeting with results from this last fiscal year's annual report, so that you all can see what we're seeing, and we're going to break it down by jail so that you have an idea of what your organization, what your facility looks like. And I want to do that at a little bit of an update at every quarterly meeting. So I need that data to be able to do that, right? Accurate and good and reliable data. And I think at the end of the day, it'll lift all boats, right? Because it helps us justify getting you the money that you need. It helps us go into the higher ups and saying, this is why we need money. These programs are effective. They're working. Here's how many, here's the numbers, so that we can get you more money. And then helps us, right? So we can show, hey, we're doing what we need to do. So the whole point of this kind of move to a more robust monthly contract monitoring tool is to lift all boats. And so I just really wanted to make that clear that none of us are trying to do this to throw more work at you, like make your jobs harder. We're doing this because the more accurate and concise and reliable the data is we're collecting, the easier it is for us to make arguments that our programs are effective and that the money is being well spent. And that's the goal for all of us. So I just wanted to make sure that was clear. And my goal is to get that data back in front of you so that you can use it for your purposes as well. It's not just for us to like hoard and collect in the back, so that you can get that data and use it for whatever you need it for, right? I did want to remind everybody, so we have the GAIN office hours are on Wednesday, August 7th from 2 to 3 p.m. If you have questions about CivicWar, GAIN, the monthly contract monitoring tool, anything, you can bring those office hours. They're titled GAIN office hours, but really we want them to be kind of, office hours for any of the systems or data tracking or anything, any questions that you have, feel free to come to those office hours with those questions. And if it can't wait for the office hours, please feel free to reach out to me directly. You can reach out to Becky when she gets back, or Kelly, or anytime. Like, we're all here to kind of answer those questions and get you the information that you need to be successful, right? And so again, we schedule those we're going to have those monthly going forward. So once a month, we'll always have office hours where you can come down, ask questions. But if you need a question answered before then, like I just got a question last night, woke up this morning, got that answer out, right? And that's my job, is to get those answers and get that support to you, especially on the technical data side of things. So I'm also happy to help with other data needs upon request. So I have a meeting with Pueblo this afternoon where we're going to talk about putting together a data tool for them for additional information and data tracking. Or if you apply for the RSET grant and maybe you don't have the capacity to kind of create your own tool to track all that stuff, we're happy to help you put that together in coordination with Amy and your jail or your facility and us, and get that tool to you to make your jobs easier so that you can collect that information for the grant reporting, right? Like, in a way, like, we're here to help you and provide that technical assistance wherever we can, okay? Yeah, and that was the gist of kind of the kind of talking points I wanted to go through. And again, I just want to emphasize that, we're here for you. I'm here for you to provide that assistance and answer questions, and that we're here to kind of lift all boats and get everybody the help that they need and the funding and the support that they need. So without further ado, I'm going to go ahead and turn over to the training document. I'm going to have to share my screen here for this. All right, so this is what the monthly contract monitoring tool looks like. Can everybody see this? Okay, so we'll kind of look at this in just a minute. I wanted to start with this. We've got this training document that I put together that basically is just kind of helps guide you through it. And you won't need this training document after you get used to it. After the first couple of months, you probably won't need this anymore. This is just to kind of get us off the ground and get going. So before we had the spreadsheet, right, that we were using, and you filled out the spreadsheet. We've moved to a new format, which is a Google form. It's a survey format. And so it's basically, if you've ever done an online survey, right, it's through this process. So basically, you go in, you fill out your email here so that we know where it's coming from. And if there are any problems, we can contact you and we can work that out. And a lot of this stuff is based on drop-down boxes, right? Drop-down boxes and little bubbles. So your Adams County and your contact is Becky, right? Each of these questions is going to be required too. And so you can't skip any questions. And I'll show you what to do if you don't have any information to put in. You can't skip it. You got to put in something else. But we did that so that every question gets answered from every jail, right? And so it's built in sections. And so once you finish a section, you got it filled out, you click next, and it'll move on to the next section. So these are JBBS program questions, right? And I'll get into kind of these questions in particular a little bit in just a minute. I want to go back to the training document and say, okay, so valid email address is required so that we know who's filling it out and we can contact them if there are issues. You do not need to have access to Google Programs or a Gmail account to complete this form. As long as you have internet access, you should be able to click the link and fill out the form pretty easily, right? So there were questions, well, do I need a Google account? Do I need a Gmail account? No, you do not. You just need to have access to the internet and a valid email address that you can put in there, and that should allow you to do all this stuff online. If you're having any problems with that, let us know, and we have a backup form that we can use that should substitute for this, right? So, but the reason we're doing all this in this form is it's really easy to collect this information on the back end and aggregate it and visualize that data. So that we can, again, kind of troubleshoot and make sure people are meeting their deliverables and getting us the information that they need. As I said, a new link is going to be sent out the first day of each month. So like this one right here, you see right here at the front, it says July, JBBS monthly contract monitoring tool. So the one that comes out in September, it'll say August. So it should be really clear. I'm putting out at the front of the title and not at the back so that you know exactly which month, because we don't want you switching up months, right? It's really important that the July information gets entered into the July monitoring tool, the August information gets in the August monitoring tool, et cetera, et cetera. So it'll come out on the first of the month, and then it needs to be completed by the 20th of each month. So like I said, the information from July will be due August 20th, okay? Each facility should submit only one per month per facility. Right. So sometimes you have multiple people working, multiple clinicians and stuff. Make sure that you designate like one person to fill this out, because if we get 3 different monthly contract monitoring tools from the same facility, that's going to skew our results. It's going to give us some weird looking data. So we really want the idea is to have one coming in from each facility for each month. And then at the end, we'll have 49 or 50 or whatever different responses all aggregated together. Okay. Every question is required, but if you have nothing to say or no information to share for a question, you can simply put NA, right? So I'll just give some examples. So the first question here is the most important one, but we get into some other ones down here. Please list all JBBS group sessions that occurred this month. If you don't have group sessions, just put NA. So the question is required. You have to put something here, but if you don't have any JBBS group sessions in your facility, just put NA. Right, and that will satisfy the requirement, and it will let you continue on and onto the next section and stuff like that. So it's not that, again, if you have information to share, put it in there. But if you don't, just put NA, and that'll allow you to move on through everything. Questions that ask for a number should have answers that are just one number. So one of the things that I'm seeing in the monthly contract monitoring tool from fiscal year 24 is it'll ask, how many JBBS individuals have been served this month, and people will break them down by category. It'll say like 39 SUD and 42 mental health and 22 competency, right? If for most of these, we just want one number, because it's hard to do all that addition for 50 different counties and 12 different months a year. So when it asks for a number like here, how many unduplicated individuals receive JBBS services this month? Just one number, add SUD, mental health, competency, add those all, anything that you have, add those together and give me one number. Because then it just makes it a lot easier to analyze the data in the aggregate, right? Instead of having to do all this additional math on the back end, right? We can just take that one number add it to all the other numbers from all the other facilities, and then really easily we can pop out a number and say, this is the number of people that have been served by JBBS services in the month of July. This is the number of people that have been served by JBBS services in the month of August, right? So when it asks for just one number, make sure that you're doing what you need to on the front end to just put one number in there. If you have questions or require clarification on what that number should look like or how the math should happen, well, who all do I add in to get one number? Feel free to reach out to us and we can clarify, we can meet, kind of work through that and get you that answer so that you know exactly how to get to one number. I'm not trying to make it harder necessarily. I'm just trying to get everything kind of formalized in a way, in a nice, neat package that's very useful for data analysis, okay?
Alex, before you go on,
yeah.
we have a couple questions.
Yeah, can I wait for those? I'd like to just go through this and I'll answer questions at the end. So one of the most important questions is at the top of section 2 of the program questions. It says, how many unduplicated individuals received JBBS services this month? That's why I moved it to the very top of this section, because that is literally the most important question for us right now to be able to collect that together, okay? So, right, this question is asking how many clients in your facility were touched by JBBS funds. So it could be an individual session, it could be a group session, it could be a backpack, could be medication. If that individual received services or supplies that were paid for with JBBS funds, they should be counted in that one question. And the idea there is we want to make sure everybody who is being, that's receiving some sort of service or supply or something that comes from us, that we're counting that individual in one place, right? It's meant to be an umbrella category and capture the largest possible number of individuals that receive JBBS services. Importantly, though, don't double count people. So if somebody's going to an individual session and a group session and they get a backpack, that counts as one person, right? They only get one number in that category. If somebody gets a backpack and nothing else, they get counted in that category. If somebody goes to one individual session, they get counted in that category. And again, we want to be able to demonstrate, here are all the people that are being touched by JBBS funds. Like, our funding is supporting this number of people per month. So don't double count people and don't artificially inflate the number, right? Don't add people there to make the number look bigger. The number will speak for itself and it's totally fine. Some jails have fewer people in a given month and more people the next month. It's okay to see that variation. That's not a big deal. What we want is an accurate count of that stuff. Once you've completed the monthly contract monitoring tool, please remember to submit the form at the end. Like, there's a big click submit at the bottom. If you don't actually submit the form, it doesn't get submitted to the system and doesn't get collected so that we can analyze it. As I mentioned, if you have questions or concerns or issues with the survey form or the questions that are being asked, just reach out to the program managers, or you can contact me directly as the data coordinator. I've got my email address here. It may take a little time. This form is a little longer than the spreadsheet was. There are kind of extra questions. There's a total of 52 questions if you count the county at the beginning. There are 52 questions, which is a little longer than what you're used to. And so it might take a month or 2 or 3 to kind of get the hang of it. But the idea is that once you get used to it, it should be easier and faster to fill out than previous monthly contract monitoring tools, because you're not having to type out a whole bunch of information. You don't have to break down the numbers, in one line. We're putting it all in front of you to make it really easy to just go line by line by line by line and then submit it. There is a new section in this version that asks for feedback for JBBS program and program managers. So you can let us know in that section if you're having problems, or if you think something needs to be improved. Like, we're going to be watching that section really closely so that we know if there are issues or problems that are coming up. But also be aware that it's not an anonymous feedback section, right? You're putting your email address up at the top of the things so just do with it what you will. Like, probably not a good place to be like, this program managers suck and they're not doing their jobs right. It's not anonymous. So, constructive feedback. And again, we're happy to kind of see those issues, monitor those issues, and work with people, but just know that it's not anonymous information, right? We know who's submitting each of these monitoring tools. And then keep in mind, just in general, that more accurate and complete the information is on the monthly contract monitoring tool from each facility, the easier it will be to justify budgets and potentially request or receive more budgetary support for the programs and for these services. The goal here is to raise all boats and help everyone receive the assistance that they need. It's not to put an undue burden on anybody. It's to kind of get things up to a level where it's a lot easier for us to justify not only the money we're currently receiving, but justify more funds because we can demonstrate that these programs are effective and they're doing the things that we want them to do. So before I get into the next piece of things, which is just to show you what the actual form looks like, I'll go ahead and take some of those questions. So let me look in the chat here. The backup form. So the question is, would you be able to share the backup form? That would just enable us to figure out who will be responsible for filling out the form and making sure we're capturing the data in the most efficient way. I'm happy to share the questions, right? And it's so that you can see the questions. The form is like it's a backup form, and I'm going to keep it in reserve until we have, and it is literally reserved for counties that cannot do the online thing, right? So if they cannot fill out the Google survey, that's what the backup form is. But I am happy to share the actual list of questions so that you can see everything that's on there and what the options look like. So I'll get that to Becky and Kelly, and we'll get that sent out to everybody for sure. But again, the backup form's kind of, we're holding that in reserve because what we don't want is people to use the backup form instead of the main form, right?
No, makes
form.
perfect sense. I'm mainly like the questions there.
Okay.
That's mainly what I wanted to look
totally.
at without having to like go through the form itself and just easily reference. But yeah, I appreciate that.
Okay, sounds good. So not sure, won't let me share my screen anymore. So here we go. So here's what the questions look like. I have this form. It's got all the questions lined out right here. So I'll share that with you all for sure. And then, yeah, I mean, everything else is I tried to make it really clear line by line on with the questions, what we're looking for, right? So how many unduplicated individuals received JBBS services this month? And again, unduplicated means you're not counting them multiple times. So if they got a backpack and they went to a group session and they went to an individual session, that's 3 different things that JBBS did for them, but they're only going to get counted as one person. That's what unduplicated means, right? So you're not counting people multiple times, even if they received multiple services or anything, they're just being counted as one person that was touched by JBBS funds. So when it says unduplicated, that's what that means. So then, that's our umbrella question. This number right here should be the biggest number on the sheet, basically, right? And then it breaks it down. How many JBBS clients were released from custody? Based on the number of clients who were released from the facility, how many returned to custody this month? Based on the number of clients released in the past 6 months, how many returned to custody this month? And based on the number of clients released from your facility in the past 12 months, how many returned to custody this month? So it's like in any given month, how long has somebody been away from the jail? And part of the reason we're doing this is because we need to look at recidivism. We need to know how many people are coming through the JBBS program, going out, being released from the facility, and then coming back into the program, right? Because then we can compare that number with what recidivism looks like overall. And in theory, the hope is, right, one of the goals of this program is to reduce recidivism. So lower numbers of people coming back who have gone through a JBBS program than people who did not, right? So this is how we're trying to get at that. Yeah, Cassandra.
So for recidivism, though, if they're not coming back into our jail specifically, but going into another jail, how are we supposed to be tracking that?
I wouldn't worry about that. That's one of the things that Civicor is for, so we can look at it. This is just, and again, I know that you don't know what's going on in some other facility. This is just for you. If you know that they were in a JBBS program somewhere, right? If they volunteer that information and they're back and now they're in your facility, then you can count them here. If you don't know that, and you have no way of knowing that, right? And to you, it just looks like they just came in off the street and they're in your facility. That doesn't count as recidivism. What we're really looking for is the people who have left your facility that you know were in JBBS and then they come back. That's what we want to be recorded here.
Okay, that makes sense. Thank you.
Yeah, of course. Yeah, and again, that's why we also have Civicor, because that allows us to track those other things separately. That allows us to get more of a bird's eye view of what's going on in every facility. This is more what's going on in your facility and how does that compare to other facilities versus Civicor, which gives us a complete picture of every facility in the state, okay? So these other questions, and again, these ones are all just number answers, right? Based on the number of clients who are released, please provide just one number. Even if it's 0, just put a number in there. Then we get into these other, does your program utilize individual sessions, group sessions, or both? For most of you, that's going to be the same for all 12 months, but in some facilities, it changes. Some facilities only have individual sessions, and then they're going to add group sessions later, right? So we can track that variation. We can see over time what's happening with these group sessions. Then the next question, please list all the group sessions that occurred. If you don't have any, you put NA. Then what's the number of JBBS group sessions? So we have a number that we can put, okay, 17 group sessions in this jail, 12 group sessions in this jail, 5 group sessions in this jail. And if we have just one number, and then I can add all that up and say, okay, between all the different jails in the month of July, we had 72 group sessions, right? Or something like that. Then what's the number of individual sessions that occurred this month, right? So we're differentiating between those. Have there been any, I'll get you in just one second, Caroline. Have there been any updates, right? This is one of those where it's just yes or no, right? Yes or no question. And then what we have here right underneath this is if yes, please explain, right? So the question number 10 is just yes or no. And then in number 11, you have a chance to explain what those updates or changes look like. And again, that allows us to say, okay, 52% of jails had updates or changes in the month of July versus, 20% of jails had changes in the month of August. It allows us to track that stuff over time without having to read every single word. So it's like we broke it into 2 questions so we can collect that information, just yes or no. And then we have the space for you to add that narrative in, right? Caroline, what's your question?
Hello. I was just wanting to ask, and I had put it in the chat. So for listing all the groups, what exactly do you mean? Like because we do, for example, that would be like 20 different subgroups a week. So are you saying list like the date and time and title of each group, or are you just saying?
So like the question where it says, what's the number of JBBS group sessions that occurred this month, right?
No,
if it's
not
20,
the number. It actually says, please list all number 7.
I know.
List all JBBS group sessions that occurred this month.
Right.
How would you operationalize that?
Well, so number 8 actually helps us answer this question. What's the number of group sessions that occurred this month? So if it was 20 group sessions, I would expect a list of 20 for number 7. Does that make sense?
Yeah, I'm asking I'm asking how to answer number 7. Sorry.
And I guess I don't know enough about group sessions to answer that, right? Like it depends on what they look like in the facility. Like, could you give me some examples?
Yeah. So do you just want like we're doing SUD groups, MAT groups, CEP groups? Like literally that phrase? Like what is it what data are you hoping for?
How many SUD groups are you running each month?
We're running about 20 per week. I don't know what you mean group. Okay. If you can tell me what it is you want to know by number 7, that will tell me like what's the point.
I want to know every group session that takes place in the jail, a list of
So you want to know that like.
So if there's 20 that are occurring per week, like let's say, so that's 80. So you'd say we have 80 SUD sessions per month and we have.
Right, but then I'm saying for number 7, then do I need to write all 80 dates?
No, you just tell me. So what is the number of JBBS? That has to be one number. So you'd add everything together, the SUD groups,
I don't know if I could, I don't know. I'm not explaining it well. I understand number 8. It's number 7 that I don't know.
Can I jump in real quick? Like, I'm almost wondering, so like where my head goes is, you could go real broad, like, hey, this is a SUD group and this is how, like, maybe there's a SUD group, maybe there's like a, I don't know, competency enhancement specific group. Are you wanting like more broad data in what it is? Or are you looking for like zooming into like, we have different modalities within each group as well? So you wanting to zoom into specific type of modality, or is it more just from a like super broad, like SUD, comp enhancement?
Yeah, like if you have 20 SUD groups per week and 14 comp enhancement groups per week, right? Then I would want to know, okay, so 20 times 4, that's 80 SUD groups, and then 14 competency enhancement. So that's times 4. So that's.
I think if I can, I think maybe if we separate sessions versus group. So number 8, I understand you're asking how many sessions, like how many times did we meet for a JBBS group of any kind this month? So if we met for one of the groups, you know, we met with a subpopulation of the group for anger management on Monday, and then on Tuesday we meet that same anger management group, but a different group of patients. So we met again, that would be 2 sessions. So we're counting just the number of sessions of contact. I understand that for number 8. It's number 7, then would you want me to just list anger management? Or would you want me to literally write on number 7, Monday, July 15th, anger management, Tuesday, July, whatever, I'm not oriented, is anger management? Or do you just want, we covered anger management in SUD, we covered relapse prevention in MAT, and we covered this in CEP for number 7?
Yeah, the second answer, right? I don't need to know every single group that occurred at every moment, but I do want more detail on what's going on in number 8, right? Like, you know, like I
Yeah,
want to kind
okay,
of break
just
down
like
what's
how we
going on.
describe what's happening in our group treatment. It just seems like, okay, so number 7 is basically just replacing, describe what you did in JBBS this month
Yeah, for the group session piece
for
of
the
it.
groups.
Yeah. Yeah,
Okay,
it's
like a
give
brief
it some more
summary.
detail, right? I'm not sure. I
Okay.
don't want you to list out every group that happened. That take way too much time. But I
Yeah,
do want to kind of bird's eye picture, not just of the number of group sessions, of group sessions. You know, what's going on in those groups. And again, you don't have to list them out line by line, but if you
Yeah.
collect that information together and say, okay, well, 8 of them were anger management related and 7 of them were competency enhancement related. Like, it's just so we can get some more detail on what's going on in the group session.
yeah, exactly. We do that now in our monitoring tools, so that is completely fine. I didn't know if you were using it to cross-reference something in Civicor or something.
No,
I didn't know what your need for the data
it's just
was.
so we
Thanks,
can get a
everybody.
bird's eye picture of what's going on in the group sessions, right?
Okay, yeah.
Yeah.
Thanks, Alex.
Yeah,
Sorry,
you got,
y'all.
no, Becky, did you have something you wanted to comment on?
No, I was just trying to help a little bit, but you got covered, so I think we're good. And we only have a couple minutes to wrap up. We need to get Robin to pop in here too. So if we could try to wrap up, that'd be awesome.
Yeah, sounds good. So I'm just going to finish this section so that you know what it looks like, right? Because this is the most important section. This is the programming. What is your programming doing, right? So number of group sessions, number of individual sessions. Have there been any updates or changes, which we need to know, like if you're changing something in the program? If yes, please explain. And if not, put NA. Has your program encountered any challenges this month? And again, this is a yes or no question. And then right after that, it's if yes, please explain. Because again, if you, with the yes or no, we can say, okay, 75% of JBBS programs are experiencing challenges this month. That is a red flag to us that something's going on, right? So it gives us that ability to kind of look at that number and address that. And then we can dig into this detail through your answer to number 13. Then were you able to resolve these issues? Yes or no? That tells us a lot. And again, if you had no issues, then you select NA, no issues. If so, what was the resolution? Like, how did you resolve the issue? And if there were no issues or resolutions, just put NA. Please provide any personal or programmatic success stories regarding JBBS programs or clients. This is an important one. This is your chance to put a narrative on, here's what was successful this month, right? And again, we're going to highlight this stuff in the annual report. There's another one of these questions in the MAT reporting section. So please provide any personal programmatic success stories regarding MAT. And we're trying to separate those things out a little bit, right? So that if you have a JBBS individual session that's been really successful with this individual, and then something is going on in MAT, we can highlight both of those things, right, separately. And then down here at the bottom, are there any other needs for your JBBS program that we can assist with? Yes or no? And again, that allows us to, okay, 15 out of 50 jails do have problems that they need help with, right? And then if yes, please explain, right? And if not, then just put NA. So that's based, and there's 3 other sections. There's the MAT reporting, there's the finances. I can bring it up here. So MAT reporting, which is shorter and asks some similar questions. There's the budget questions, which in the previous monthly contract monitoring tool, those were at the top. So we've rearranged things because we want programming. We want to know about the programming. That's one of the most important things. And then there's the budget questions. And then at the end, there's the feedback, right? So you can rate the JBBS manager performance on a scale of 1 to 5. What improvements would you like to see? on a scale of 1 to 5, how would you rate the quality of technical assistance that we're providing? Do you have any additional feedback? And then literally, are there any other needs for your JBBS program that managers can assist with? So again, I've expanded this module at the bottom for you to provide feedback to us and for us to identify if you need help, right? More easily say, okay, here's this program that's struggling. They need help with these things, right? We'll be taking an extra close look at that feedback module so that we know if you need assistance from us, right? I guess if you have questions, put them in the chat, or you can email me and I'll try and respond to you probably through email. And then I will turn it. I thought I had 45 minutes, Becky. I'm sorry. I'll turn it back over to the next person.
No, Alex, you're totally good. We were just looking at the clock, and I think Robin was also hoping for a little bit more time. So no, we totally appreciate it. I want to put it out there. Alex is available for questions. This was a part of discussion. We want your feedback. This is also not due yet, right? We still have June's monthly contract monitoring tool due in here in a couple of days. So we wanted to go over this all with you, with you all to make sure you have kind of a little bit of guidance. We've rolled out monthly contract monitoring tools with zero guidance, and you guys have made it work. You all have been rock stars making it work. And now we're trying to provide that guidance now that we have Alex on board and we're switching up the format. But please know, Alex is available if there are any ongoing questions. We are available if there are any ongoing questions. This form will also be coming out officially on around August 1st. We're going to, like Alex said earlier in the presentation, we will be putting these forms out on or around the 1st of the month to make sure then you have that 20-ish days to submit it by the 20th of the month. So this form we will be, thank you, Kelly, for putting Alex's email address in the chat. We will make sure that we resend the link to this form. Probably August 5th is probably what we're going to do, unless, let me look at the calendar real fast, unless Alex or Kelly can send it out on the 1st or 2nd. I will not be back until the 5th. I can send it out on the 5th, but we'll discuss that on our end. So you're going to get this officially anywhere between the 1st and the 5th of August, and then it'll be as close to the 1st of September that we can get it out as well. So kind of put that out there. Alex, anything to add to that? Anything I said wrong that you want to correct? Anything?
Just when we send it out again, I'll make sure it comes with the training document that I just went over and the questions like Ben asked for. So you'll have all that together so that you can decide that. The other thing I wanted to add is, again, this is our first run. If we get feedback and something's not working, we can change it. We can move things around. We can make it work. The other thing I want to say is I can add a section. If your, jail needs specific reporting for something else, I can add an additional section. It wouldn't be required for all jails, but I can put it on there and then we can get you that information. So it's flexible, and again, the benefit of us being internal to BHA is we can work with you. It's a lot harder to go to Chestnut or one of these bigger entities and say, hey, I need you to change the gain. It's not working for me. That's pretty hard for us to do. But this is something that we have oversight and control over, right? And so it makes it, I want it to work for you and I want it to work for the program managers. And that's my goal. So again, once you get through it and you're having feedback or you have questions, let us know. And again, we can incorporate that stuff into this thing moving forward. So that's the last thing I had.
As far as the questions, Ben, Alex, can we get that list of questions out to folks today? Yeah. I have sent it out to folks. Have asked for it after we sent out the agenda with this on there. But if Alex, you want to just send a blanket email to everybody on here, that would probably be fine. That way folks can have it ahead of time versus waiting until the 1st of the month.
And the reason it's not set up to where every question is just listed on the original form is then it's a lot easier to have it in sections, right? Finish one section and move on to the next. So that's why it's not set up with all 50 questions just in a row on the Google Sheet. So that I will absolutely get the one that has all 50 questions in a row sent out to you so that you have that for sure.
Awesome. Cool. Thank you, Alex. Any other questions, concerns, anything? Looks like Kelly got Chris's question answered.
So you're just going to get one monitoring tool for the whole Southeast catchment, right? So That's how it's set up right now. So you just aggregate that information from the different jails, put that in one monthly contract monitoring tool, and hopefully that's easier to do than 5 separate monthly contract monitoring tools for each county.
Awesome. Well, thank you, Alex. We
Yep.
appreciate
Thanks,
it.
everybody. Thanks for your time and your attention.
Any questions, anything, please feel free to reach out to Alex directly. Please feel free to reach out to us as always. We will get that list of questions to you probably here soon. Alex is probably rocking on it right now as we speak. So be expecting an email fairly soon from Alex. With that, I'm going to go ahead and pass the rest of the conversation on to Robin. Robin, are you here?
I am. Yep. And I think I
Awesome.
started sharing my screen.
All
All
right,
right.
good.
Hi, everybody. About a year ago, we presented to your group about fentanylEdColorado.org, which was the online education that is mandated by Colorado's fentanyl accountability and prevention law. So this site and learning opportunity launched in January of 2023. And in that first year, we learned that it could be used in some settings, but not in all. And so the request was very specifically from jail settings to offer a video-based course, and ideally in an abbreviated time frame. So we did just that. We set out to design the online course to be mirrored in a 34-minute video course to be delivered by trainers, just like the online course was, but trainers that had various barriers, such as internet or hardware or staffing, that made it hard to do one-to-one or one-to-many with the online course format. It's important to mention, though, that this video course was not designed for independent learning. It was designed to be facilitated by a facilitator that will help with its registration, not that people self-register, but to collect the information for registration, as well as be there for questions and discussion and that sort of thing. I'll go over that here in a few minutes. I just wanted to emphasize that first and foremost. And then we'll go over some of the tools in the how to present fentanyl education for trainers in this time as well. First, for those of you that have not accessed the education previously, I just want to do a quick overview. So the main components of the online course and the video course are to review, or topics, I should say, what is fentanyl, or the effects of using fentanyl, harm reduction, which we call lowering your risk in the courses. And within that section, there are how-to videos for how to use fentanyl test strips, how to administer naloxone, a topic section on Colorado fentanyl laws and on treatment. And in the treatment section, there's also a presentation done by Dr. David Mendez on medications. After each one of these sections, there's a knowledge check. And I bring that up because this is a learning integrity aspect of this, that we want to make sure that learners are engaged and they're able to show that and demonstrate that they've learned something from it. And this is one of the points that we mentioned when it's ideally facilitated. This is a great discussion opportunity. So if learners want to share their experiences or ask questions, knowledge checks are a great time to do that. I'm going to show you 5 minutes of the 34-minute course. The 5-minute segment I'm going to show you is hopefully going to demonstrate all of the components of it. So it will show you some of our on-screen narrator who's doing some teaching, if you will. It will show you some of the lived experience stories, which we have both men and males and females now in the lived experiences. And it will show you, various other pieces like resources and that sort of thing that are included. So I'm going to switch my share to a different screen here. This is the homepage of the course. If you've ever, if you have not gone to it, we would really invite you to come here and register. I'm going to show you, after I show you the video course, how you're going to access this, but let me jump this to this 5-minute section here real quick.
In this video, all found help in different ways. You may find help by searching the internet or by asking a caseworker, healthcare worker, someone in the justice system, or someone you know. If you're currently in jail, prison, or a treatment center and have an addiction or possible addiction to fentanyl or other opioids, ask to speak to the Jail-Based Behavioral Services, or JBBS representative about screening for medication-assisted treatment or your counseling. Another source of help is the Colorado Fentanyl Education website. It provides the Colorado hotline number and a list of resources to help with various problems you may have. The information is free, and you don't need to give your name or email address. Now for our last question, true or false? Medications that treat fentanyl or other opioid addiction are most successful when used with counseling and social support. The answer is true. Medications help with withdrawal and cravings, but overcoming substance use often means learning how to deal with life problems that are different from person to person. Working with the therapist, counselor, and peer coach on these problems help the person move forward to live a happier life.
I would say if you're watching this, then to stay as far away from it as possible. It's nothing that you want to try or get involved with.
I would say to anybody who's thinking about maybe trying to get clean, it's possible. I had given up on myself for a while, and didn't think there was any way I was ever gonna step out of the darkness. It's not gonna be easy. You're gonna have to ask for help, and that can be really, really hard. But once you do it, there's a lot of help out there. So I would just say to anybody who's thinking about maybe trying to quit, just do it. It's worth it.
I think that being in recovery has completely not just healed me from the inside out and my mind, but has also turned me into the person that I have always wanted to be and who other people have always seen me as. Not grateful that I went through addiction, but at the same time, I'm blessed that I made it through addiction.
Learning from my experiences, I would like everybody to know that there is help out there if you want it. Just take a chance. Your life can only get better from here.
Like if I stop my NA program, then I'm probably going to relapse because I have 15 months of lived experience of using on top of Sublocade. But ultimately, it needs to be you who wants to seek treatment. My suggestion is that people go to treatment, and when they're there, they learn as much as possible. They make as many connections as possible. They find a 12-step fellowship or some kind of recovery program outside of treatment that will work for them. And I'm not here to tell one's better than the other. It's a personal choice. It's whatever works for you, and that's going to keep you clean.
So I go to Narcotics Anonymous meetings. There's several around Colorado, very easily to access on the internet. And these meetings, I'm able to go and talk with people that have gone through, you know, what I've been through or worse.
I wish I could go back and not go through what I ended up going through and not letting it get as bad as it did.
Now that I'm in recovery, I feel a million times better. Don't be scared to withdraw. Don't be afraid to live.
I know a big problem with a lot of addicts, and it was my problem, was I thought that I wasn't worth it. I thought I wasn't worth it enough to recover. I thought that nobody would care if I lived or not, and everyone's worth it. Everyone's worth recovery. Everyone's worth that second, third, fourth, fifth chance, however long it takes you to realize that you are worth recovering for yourself, not for anybody else in your life, but to recover for yourself, to become that person that you know you can be and that everyone else knows you can be. it's worth it.
This is the end of our look at fentanyl. We hope it was helpful and encouraging. The volunteers you saw in this video and the team that worked on this video wish you a bright future and hope that if you are struggling with fentanyl, other opioids, or any other substances, you'll seek treatment. You deserve it. Recovery is possible.
Okay, I'm going to navigate back to my slides here very quickly. And you know, the lived experiences are powerful, to be sure. And likewise, trainers, persons facilitating this course add value as well. If you have previously accessed the How to Present Fentanyl Education course for trainers, it's been modified to now include the video course. So how could you administer the video course with court-ordered learners in your particular settings? There's a whole section designed on, you know, how you can set it up and what you can do. I have a slide that'll show you that here in just a few moments. But first, just to quickly cover, you now have two options, and that is the online and the video course. So you can choose either or to use or use both. The functionality of adding in-person learners has not changed, and it's the same. So whether or not you're using the online course or the video course, the tools that trainers have available to them will be the same and accessed in the same place. And I juggle back here very quickly to my other screen. So when you've registered for the course, this should be the default page that you have access to it. We call it the My Account page. So fentanyl education is what is required for court-ordered learners. And then how to present fentanyl education is for trainers. These are the trainer tools that we've referenced. So adding an in-person learner, I'm just going to quickly go to this and show you. This is where you would enter your name in this form, your first name, last name, or I'm sorry, not yours, excuse me, your court-ordered learner's first name, last name. Their email address is not required, but highly preferable, because if you have an email address for your court-ordered learner, that means the system will automatically send them a certificate of completion. So they will have documentation of completion in an inbox whenever they would be ever able to access that. So if you have an email address, that's very nice to include. Court case number, if you have it, the county court, race and ethnicity, gender, age, preferred language, and then where the course is being taken from. So DOC facility, county jail, treatment, you know, the various options there. I'll also go back and say that this form can be used for one person, or you can continue adding learner after learner. I've seen trainers add 20 learners at a time. So you can keep adding and using this. You don't need to refresh each time, and then click submit. And that way the system has captured that the court-ordered learner has taken the course. Once you've entered them there, you're able to then go to download certificates. Had I entered somebody, their information would be populated here, and you would be able to print from that screen or download to print from your applications. Download trainer materials. That is actually a zip file that that goes to your computer, and in the file there are the handouts that go after each one of the sections, or for each section, I should say. So this is a great way to support learners that have different styles. So some people are visual learners, some people need to read, and if you're showing the video, it's a great support tool from a learner's perspective to offer the paper overview of that section as well. And that's available there in English and in Spanish. as well as the paper-based registration form that goes with that add in-person fields that I just showed you. So the paper-based registration form is there. Then I played the video from this button, the video that I just played for you. It's also downloadable from that. So if you go to the lower right here, there's an ellipsis here. And if you click on it, the first option is download. So that's how you would be able to download it if you're going to use it in your facility outside of a laptop like I'm showing to you here. This is a large file. It's 1.4 gigs. So you don't want to download this video over and over again. But if you're downloading to an external hard drive so that you or your team members can use it to share, via whatever mechanism you have, a smart television or something like that, you also might want to download the file to provide to your vendor service so that it can be on your tablet. And you can use that to show court-ordered learners through a tablet. But I just wanted to show you there how it can be downloaded. I think I'm going to go back really quickly here and just say the only thing that's going to change about this page is that you will also soon see a video button for Spanish. So the entire course, online and in video, will be available in Spanish. The online course is available in Spanish now, but the video will also be available in Spanish. And you'll be able to download it from a different button. I suspect that the video will be added the first week or two in August. So that's our delivery time for that. All right, switching back again to PowerPoint slides. I just showed you this, so I will quickly forward through that. I wanted to just bring up this screen, and this was taken exactly from or directly from the How to Present Fentanyl video or Fentanyl Education course. And it's 5 steps to how to present the video course. First of all, having learners complete the paper registration form. I understand that some of you may be taking it directly from your online system and then entering it and add a learner. And that's fine, I understand that. But if you also want to, you could use the paper registration form. And so you could complete the add in-person learner fields more completely. And then you would play the video for learners, pausing ideally after each section to discuss the knowledge check question, to open it up for questions and sharing. We've definitely heard from trainers that have used this so far and that have also used the online course. It definitely spurs conversation, spurs sharing. So if you're using in group settings, you've likely experienced that as well. Just assessing whether the learner has successfully completed. This is part of the role of a trainer, is making sure that the material is understood and that we've been able to answer all of the questions. This is also why we encourage and want trainers to complete the fentanyl education course for court-ordered learners, as well as the trainer course, because the course-ordered learner course that's available online is the most comprehensive course, more comprehensive than the video course. Adding learners, like we just talked about, and then providing the certificate of completion for learners so that they can show the courts that they have met that criteria. Just a quick takeaways, adding the court-ordered learners through that add in person or for them doing it themselves is the only way for us to show that the completion has been done and that for them to receive credit. There's 2 options, the online and the video course. And the How to Present Fentanyl Education course has been updated to include the video course that's been available since the beginning of this month. We encourage you to reach out to Karen at the Behavioral Health Administration, as well as through Help Fentanyl Education Colorado with any questions anytime. We're always here for you to answer questions and provide whatever information we can. I've been going at it pretty fast. I see Karen's raised her hand, but we invite you to unmute yourself or use the chat to ask any questions you may have.
I just quickly wanted to say it's been a pleasure working on this project with CU and Robin and Bonnie, and how much I appreciate the work they've done on this. And if anybody at all has need for more individualized technical assistance, I am available. Just send me an email and I will get back with you, and we can schedule a one-on-one type of video meeting, and I can walk you through some steps if you need more help or any questions whatsoever. I'm available to do that.
Great, thank you all so much. I don't see any additional questions, but again, there's Karen and Robin and Bonnie's contact info in the chat if anybody wants to reach out to them. Thank you all for your presentations today. Let me see, one quick question. Can you post the link for where we can find this page so I can push out to my team? Would Robin or Karen would want to be able to do that? Thank you. And then before we close, we're a little bit ahead of schedule. Did anybody else have any additional questions about the contract monitoring tool? We want to make sure that since this is our last quarterly, our next to last quarterly meeting for 2024, this is our largest audience. We want to make sure that everybody is understanding where we are with the monitoring tool, and if there are any additional questions, I just wanted to open that back up since we had a little bit more time. But if nobody has any questions, again, you have Alex's contact info and of course mine and Becky's as well. Okay, with that being said, I'd like to thank you all for joining us today. I know this is quite a commitment time-wise to sit on a call this long. So thank you to all of you for joining us, and thanks to all our presenters today as well. And we will look forward to seeing you all at our next quarterly, which will be in October. All right.
Really cut out there a second. Our next quarterly